Good morning, everybody. And thank you for coming, and thank you to the organisers, TechCabal. You've done a great job organising it, and I acknowledge all of the TechCabal team's work in putting together this amazing report. And thank you for giving me the opportunity to speak here. My name is Dr. Ola Brown, and almost 10 years ago now, I started West Africa's first indigenous air ambulance service. So we're in the business of moving people from lower levels of care to higher levels of care, whether that's within Nigeria, offshore Nigeria, within West Africa, or internationally. And we've moved from really a very small Nigerian company to a company that operates in 11 African countries, and we're looking to expand beyond into other areas of Africa and beyond. I also, about 4 or 5 years ago now, started, along with some of my friends, we started a venture capital firm, and we invested in very, very early stage startups, not exclusively in the healthcare space, across the board in different sectors of tech, but it has to be technology driven. So my talk is going to be focused on how to fix healthcare in Nigeria. We'll take a look at some of the problems with healthcare in Nigeria, some of the solutions that I think we should be looking at, and how technology can help us achieve those solutions. So I'm going to start my story in 1942. In 1942, a British politician named William Beveridge wrote a very impactful report. And in his report, he identified 5 giant evils that were threatening economic development in the UK. So the stage that the UK was in 1942 is they were on the brink of another industrial revolution. They were looking at their American friends, starting big businesses, and they were kind of lagging behind. And they knew that a lot of opportunity could come from developing their business acumen, developing their economy, but they felt that there were 5 great enemies that were holding them back. And William Beveridge identified those enemies as want, disease, idleness, ignorance, and squalor. But he said the most important one is that of disease. Because if you're sick, the problems of the other 4 are amplified. He also said that an effective state, an effective country, an effective nation that is focused on economic development puts healthcare first. And because of this report, they started the NHS, which was one of the first systems in the world that provided healthcare to every citizen, free of charge at the point of entry. It was not a social decision. It was merely an economic and business decision to make the country more productive. Many, many years later, Nigeria, our country, is still besieged by one of these evils, the evil of disease. And like England, we find ourselves at the brink of yet another industrial revolution, the 4th industrial revolution. And if we can take advantage of the economic dividends that this 4th industrial revolution can give us, then perhaps we can see the economic gains that the UK had when they decided that they were going to focus on healthcare and increase their economic productivity. But right now, that's not the case. As you can see from this graph, you can see that you're almost 5 times more likely to die in a car accident in Nigeria here than you are in the United Kingdom, in Turkey, in Mexico, in Egypt, in fact, even in Pakistan. If you look at the child mortality, we've compared the number of children that die to South Africa, to China, to UK, to Brazil and Sweden. And you can see us sticking out here as one of the most dangerous places to be a child in the world. When you look at healthcare spending, for every citizen, Norway spends about $6,000, the UK spends about $3,000 per person. Nigeria spends about $6,000 federally budgeted on healthcare. When you look at children that die, even compared to Iraq, Afghanistan, Syria, we still have abnormally high child mortality rates. And these are places that have been affected by conflict in the past few years. The Nigerian healthcare system was ranked by the WHO as 187 out of 90 looked at in the entire world. In short, they're saying that there are only 3 places that they looked at that have worse healthcare systems than Nigeria. And why is this the case? It's because in Africa, particularly in Western Africa and in Nigeria, healthcare is seen as a cost. And this is wrong. It should be seen as an economic investment that improves productivity, improves trade, and improves business. So what are the solutions? What are the things that we can do? What are the policy directions that we can move in to improve healthcare in Nigeria? Every healthcare policy should aim to do 1, 2, or even all 3 of these things. It should be aiming to improve quality, it should be aiming to expand access, and it should be aiming to reduce cost. And there are 5 pillars that I advise in my book that we can base healthcare reform around. Expanding primary care is number 1. Centralizing tertiary care is number 2. Focusing on 2 main standout indicators, our maternal health and our child health, is number 3. Task shifting as number 4. And sustainable healthcare financing as number 5. Because we need more finance than we're currently getting into the healthcare system. And our fiscal problems really are holding us back. So as you know, we pass a budget of about $20 billion every year. Almost 70% of that is spent on servicing existing debts. So you can imagine if you are working at one of our favorite banks and 70% of your salary is spent on the loan that you took the previous month. You're not going to be able to pay school fees. You're not going to be able to pay rent. You're not going to be able to buy food. You might not even be able to transport yourself to your favorite bank in the first place. And this is one of Nigeria's really, really big fiscal problems. And unless we solve this and mobilize more money into healthcare, I think we will be unable to do all the other stuff. So I'm going to speak a bit more on task shifting. And this is a really interesting slide because it shows the number of doctors per person, the number of surgical specialists per 100,000 people in different countries. So if you look at Greece at the top, I'm not sure if you can see very well, but they have 116 surgical specialists for every 100,000 people. If you look at the UK, they have 90 surgical specialists for every 100,000 people. The US actually has about half of that. They have 54 surgical specialists for every 100,000 people. Our friends, our emerging market friends, Brazil and Co, you know them, they have about 34 doctors for every 100,000 people. Nigeria has 1 doctor for every 100,000 people. So obviously there's a lot of arguments to say that we should task shift. Because the World Economic Forum actually says that it would take 200 years with current resources for us to be able to achieve the number of doctors that developed countries have. So one of the options for digital technologies to look at is how effectively we can use other professionals like biomedical scientists, like community pharmacists, like physiotherapists to do jobs that doctors would normally do. But obviously we need policy backing to do that. And there's good evidence behind it. The Human Resources for Health Journal talks about the fact that non-physician healthcare workers are able, with careful training and supervision, to deliver equal and sometimes better results than doctors. So there's very good evidence for task shifting. And this is why I think I put it as one of the major pillars for healthcare policy reform. There's also primary care. 80 to 90% of consultations in Nigeria, medical consultations, can actually be handled in the primary care setting. Because primary care, by definition, is the provision of integrated, accessible healthcare services by clinicians who are accountable for addressing a large majority of personal healthcare needs. So if we're able to unburden hospitals by focusing on primary care, then it reduces the cost of the overall healthcare system. And if you look at countries that are, around the same GDP per capita as us, Vietnam, Costa Rica, they have much better healthcare outcomes because they've invested in primary care more than us. Universal health coverage, and I'll keep on emphasizing this throughout this talk, based on strong healthcare systems and primary care, does not only prevent health disasters, it prevents economic disasters. And this is really, really important. That link between healthcare and productivity, that link between healthcare and business, that link between healthcare and trade, that link between healthcare and GDP growth is something that I'm going to be emphasizing throughout this presentation. This is Maraba Market. I try and talk about Dangote in every presentation that I do. So this is how I brought Dangote into this. This lady is Mrs. Ganiat, and she's one of the market sellers of Dangote cement. And people don't really realize this. When they think of Dangote cement, they think of the two big factories, Obajana and Ibeshe. But actually, the lifeblood of his company is ladies like this that sell cement in their local community in quantities that the community need. They know the projects that the people in their community are doing, so they know them very, very well. They have information on what is needed for their community. They can say, that house that you're building, you need this amount of cement. I know what you're doing. They know the projects, they know the people, they know the communities. And because of that local knowledge, they're able to be very, very successful, and they're able to do sort of hyper-specific selling to whichever community they're operating in. And I think that the link to healthcare is around primary care and the fact that primary healthcare physicians are the cornerstone and the lifeblood of any healthcare system. If primary healthcare is broken, then you can't build on it into secondary and tertiary care. And the day that this network of people like Mrs. Ganiat breaks, Dangote will go from being the richest man in Africa to one of the poorest, because this is where the magic happens, at this level, at the level of the distributors. And this is where healthcare happens. It happens in primary care. And primary care, if primary care is done well, then fewer people reach the hospital in the first place. However, what is the role for secondary and tertiary care? Has anybody ever visited Obajana factory? I have many times because I've worked with Dangote on various healthcare projects. And it's like a city. It should be a tourist attraction. Everything that you need for the production of cement, you can find in that factory. Even the mining of the limestone goes on in that facility. Every kind of experts, every kind of complex process, it's like a city. The trains that carry the cement and the materials over your head, the buses going around, the Chinese restaurant where all the Chinese workers go, the Indians, there are places that they don't even speak English there. It's a mega factory. And this is what our hospitals should be like. This is what tertiary care should be like. Tertiary care is supposed to be a rescue for people that have escaped the net of primary care, for emergencies, for complex problems. And more lives can be saved if advanced services are centralized in more specialist hospitals, while primary healthcare handles the bulk of problems. And again, there's great evidence to support this. Bulger et al. From the USA, Coates et al. From the UK, Cooper et al. From Australia, all came to the same conclusion in trauma, that central trauma systems, that where all the expertise for trauma patients are located in one location, and they do high volumes of seeing the same kind of patient, actually save more lives than loads of smaller district hospitals that don't really specialize in anything. The same studies show up for premature newborn survival. Premature, even in developed countries, premature newborn survival is 50% higher in those high-volume neonatal centers that specialize in that area. And you can go for any medical emergency. be it pediatric surgery, stroke, transplants, liver surgery, you'll see the same pattern emerging. Centralization of medical care is key to survival and patient survival and quality of care given. So I've discussed some of the policies to bear in mind, some of the policy changes that we need to bear in mind when we're innovating. But unfortunately, even if we do all of these policy changes, we're still going to have to be a bit more innovative than the healthcare systems that we see in the UK and the US, simply because we don't have as much money. The NHS budget in the UK, and don't forget, there are only 60 million in the UK, is about $200 billion yearly. $200 billion yearly. That would pay the Nigerian federal care budget 200 years. So it would not just pay for your children, it would start to pay for your grandchildren. And that is what they spend in 1 year. It's half of Nigeria's GDP. I mean, by GDP, every single transaction that is done in Nigeria is captured in GDP. It's half of every money that exchanges. Even the purchase that you made on Instagram from your friend, buying hair and shoes, is captured in GDP. And the UK spends half of that entire amount just on healthcare. And they're looking for more funding. So if you look at the UK news or the news coming out of the UK, you can see people protesting every time there's an election. We need more money for the NHS. NHS is underfunded. There are waiting lists. I had to wait 1 year for a hip. I had to fly to Spain because I needed an operation. So you can see that even at that 200 billion, which is the total budget of Nigeria for 10 years, they're still underfunded. So that means that we need to be a bit smarter, we need to be a bit faster, we need to be a bit more efficient. And I believe that there are ways that we can not do just more with less, but we can actually do better with less. And these things have been done before. When you digitalize, then I think there's like 3 Ds that come along with digitalizing any service. You demonetize, so you make it cheaper. You democratize, so you make it more available to people. And you dematerialize, so the things that you used to have to carry, you don't see anymore. So to give you an example of the 3 Ds when you go digital, is the difference, oh my gosh, like I feel so old, but I'm sure there are other people that remember this in the room, is photographs. So when you wanted to take a photograph when I was a kid, we took those photographs and then we carried it to one pharmacy. Then in the back of the pharmacy, they have one like dark room like that. So you take out the film from the camera, hand it over to the pharmacist. And then the pharmacist now works on it for a week. And you pay the pharmacist in advance. And it's only when you can get back to that pharmacist afterwards, after he has finished in the dark room and printed out the pictures, they can actually get to see the images that you took. It was expensive. It was cumbersome. It was not available to anybody, and it involved a lot of carrying physical items around. And Kodak was the master, so they were the market leader in that. As Kodak was going bankrupt, Instagram became a unicorn. So it achieved its valuation of $1 billion. And you can see the 3Ds in action there. They've dematerialized. You can't see anything anymore. They've democratized. Now everybody can take pictures and put them in Instagram. They've demonetized. Because the money for the camera, the money for the film, the money for the pharmacist, you're no longer paying. So I believe that this kind of digital disruption is what we need to do in health. And we know the technologies of the future. We know what we need to do, the technologies that we need to take advantage of to be able to do it. 3D printing, Internet of Things, nanotechnology, artificial intelligence, healthy life extension, connected healthcare. These are the technologies we need to be able to leverage efficiently to do not just more with less, but better with less. And to begin to democratize. monetize and begin to dematerialize healthcare. So once again, as Nigeria, we find ourselves on the brink of a technological revolution. Now, for the first industrial revolution, we said that Africa did not know about it because we were too far apart and there was no form of transportation. So that was the problem, it was transportation excuse. For the second industrial revolution, we said that we did not have the same materials. So while we only had red sand, they had a different kind of sand so they could build faster. For the third industrial revolution, there was no communication. We didn't have the phone lines, so they developed faster than us. Plus, our environment was very hot, so it made us lazy. This is the fourth industrial revolution. There's internet, there's mobile phone, we travel there all the time, and we really have no excuses. The previous generation of business people in Nigeria, really, most of them made their money from allocation. They built big businesses through procuring one license, being close to one general, getting one allocation, getting one oil block. Those options aren't available for us. So the question for young entrepreneurs looking to create and build big businesses in the healthcare space is, can we leapfrog effectively from analog technologies to digital technologies? Are we able to do that? And specifically for Nigerians, are we able to leapfrog from allocation to innovation? Thank you.